This article, titled Study of Meningeal Enhancement on Magnetic Resonance Imaging of Dogs with Central Nervous System Diseases, investigates the role of magnetic resonance imaging, MRI, in identifying and understanding meningeal lesions in dogs, which are key indicators of various central nervous system, CNS, disorders. The researchers set out to explore the connection between meningeal enhancement observed in MRI scans and different CNS diseases in canines. The study was designed retrospectively, meaning it analyzed data from past MRI examinations of 22 dogs already diagnosed with neurological conditions. The dogs were treated at the University Hospital of the Facultad de Medicina Veterinaria y Zootecnia, FMVZ, of Universidad Estadual Paulista Julio de Mesquita Filho, UNESP, Bochacatu, between January 2018 and December 2020. The inclusion criteria for selecting these animals for the study required a history of clinical signs of neurological disease. There was no follow-up of the patients after performing the imaging exams. The researchers used a specific classification system known as the acronym DYNAMIT-V to categorize the potential neurological diseases affecting the dogs. DYNAMIT-V stands for degenerative, inflammatory/infectious diseases, neoplastic or nutritional, developmental anomalies, congenital, metabolic, idiopathic, traumatic or toxic, and vascular. The MRI scans were conducted using an SOD equipment, Model VET-MR Large 0.25T. To capture detailed images of the brain, various pulse sequences were employed, including FSET2, FSET1, FLAIR, and GET2. These sequences were used in conjunction with a contrast agent to highlight specific areas of interest in the brain. The images were taken from different angles, transverse, sagittal, and coronal, to provide a comprehensive view of the brain structures. The images were collected and evaluated with the help of the Synapse PACS digital image diagnostic program. To ensure consistency and accuracy, 3 evaluators independently examined each MRI scan. The final diagnosis was determined based on the agreement of at least 2 out of 3 evaluators. The study results revealed that encephalitis, inflammation of the brain, and neoplasia, abnormal tissue growth, often tumors, were the most frequently observed clinical suspicions, both accounting for 22.7% of the cases. Other less frequent diagnoses included ventricular dilatation and meningoencephalitis, each representing 13.6% of the cases. The least observed diagnoses were meningitis and meningoencephalitis of unknown origin, MUO, both at 4.5%. In terms of meningeal enhancement patterns, the study found a statistically significant difference in the frequency of enhancement between the Pial and Dural regions when assessed individually compared to when they were evaluated together. The simultaneous enhancement of both the Pial and Dural regions was observed in 90.9% of the cases, a much higher rate than when each region was assessed separately. Notably, this combined enhancement pattern was particularly prevalent in cases of encephalitis, neoplasia, and ventricular dilatation. Meningoencephalitis cases also exhibited enhancement in the Pial region, while meningitis only showed enhancement in the Dural region. The location of meningeal enhancement in the brain was also analyzed. The parietal/temporal/frontal region showed the highest incidence of enhancement at 27.3%, followed by the frontal region at 18.2%. Table 1 provides a visual representation of the relationship between the severity of meningeal enhancement and the different clinical suspicions. Figure 1.3 provides different meningeal thicknesses. Marked enhancement was primarily seen in encephalitis and granulomatous meningoencephalitis, while most other diseases exhibited mild enhancement, with encephalitis and neoplasms showing the highest frequency of mild enhancement. Table 2 displays the relationship between specific meningeal patterns, Dural, Pial, or both, and various clinical suspicions. The combined Pial and Dural enhancement pattern was the most common across different diseases. Lastly, Table 3 breaks down the frequency of meningeal enhancement in different brain regions, frontal, parietal, temporal, and occipital, for each clinical suspicion. The parietal/temporal/frontal region was the most commonly affected. This study underscores the importance of MRI as a powerful diagnostic tool for identifying and characterizing meningeal lesions in dogs with CNS diseases. The findings highlight the correlation between meningeal enhancement patterns observed in MRI scans and the underlying neurological condition, suggesting that a thorough evaluation of meningeal enhancement can provide valuable insights for diagnosing CNS diseases in dogs. It is important to note that this study was limited by its retrospective nature, which prevented a long-term follow-up of the animals after diagnosis and treatment. Further research, potentially with a prospective design that includes follow-up assessments, is needed to fully understand the progression of these diseases and the long-term implications of different meningeal enhancement patterns. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.